Hello, how are you today? Good. So it says you're here for a cranial nerve exam? Okay. The doctor will be with you shortly, but while we wait for him, I'm going to do some of the tests. My name is Nurse Wilson, and I am going to do some of the tests before he gets here, okay? So first, I'm just going to start off by asking you a few questions, and then we'll move into like the blood pressure, your heart rate, and just things like that, okay? Little simple things that a nurse can do that the doctor doesn't necessarily have to do once he gets here, okay? Alright, since now everything's on the iPad, you know how technology is these days, I'm just going to ask you a few questions, and I'm going to jot them down on the iPad, okay? Alright, so, can I get your full name, please? Is that with a K? Okay. Alright, your age. Wow, you look good for your age. Okay. Alright, your height. Or what you believe to be your height. Okay. Your weight. Okay. Now let's see. Do you have any problems breathing? Do you have any pain? Random like places in your arm, your elbows, your joints, anything like that? Any? No? Okay. No. Do you have any prior medical surgeries or problems? You have asthma? Okay. Asthma. Does anyone in your family have any prior? Like, do you have someone who had heart disease, diabetes? Not that you know of? Okay. Alright. Let's see. What's your eating habits like? Do you eat kind of healthy? Not really. It's like all of us. It's okay. Alright. So why are you here today if you're not experiencing any pains or anything like that? Just an annual checkup? Okay. Alright, last question. Do you have any medicine that you are currently prescribed to that we need to know about from any other places you have visited or seen? No. You don't take any other medicine. Alright. Alright, just let me fill out my stuff then. One second. Alright, all your information is in. And so now, before the doctor gets here, we are going to be doing your blood pressure test, and then we're going to be doing your heart rate, and then we're also going to be doing a sensory test, okay? Just making sure that you can still feel everything in your limbs and also feel temperature in your limbs, okay? Okay, so first we're going to start off with blood pressure, okay? Make sure blood pressure is normal as they can possibly be. So. What I'm going to ask you to do is, can you please give me your right arm? Just reach it out like this. Give me your right arm. I'm going to wrap this around it, Velcro it up, and then you're going to feel a squeeze every time I squeeze this. It is going to squeeze your arm, okay? And then we're going to hold it there for a second, and this little gauge is going to tell me blood pressure, okay? Nothing crazy. You said you used to do these at Walmart when they used to have them at Walmart? I did too. They're actually really fun as a kid. Okay, so here, let me just get this on right here. Make sure it's nice and tight. Alright. And so I'm going to hold the gauge with one arm, and I'm going to pump with the other, okay? So just bear with me, this might take a second, alright? Don't try to flex or anything, just completely relax your arm. The more you resist, the longer it's going to take. Alright, you should now start to feel it tighten a lot. It's going to start squeezing it. Alright, and let it hold. hold, hold, and release. Okay. All right, everything looks good. Hold on. All right. See, I'm gonna write that down real quick. Just give me a second. I'm gonna put that in your notes too with your other information. Oh, it looks good. You're fine. It's 120/60. You're fine. With someone your age and your stature, there's nothing wrong with 120/60. All right. Next, we're gonna be doing a heart, like listening to your heartbeat. Make sure there's no, skips, or it's irregular. Okay. So what I want you to do is, I want you to sit up. Okay. I'm going to tell you to either breathe in, like inhale, or exhale. Okay. And then I'm gonna need your permission. I'm going to go under your shirt because that's how I better feel. And I'm going to place this on 3 different spots of your chest and around your heart. And then I'm going to go behind you and listen through your back. Okay? Is that alright with you? Okay. Doctors always have to have permission, so don't think just because we're a doctor we can just touch you however we want. That's not how it works. Okay. So, relax right now. Alright, and I'm going to put this on your chest, and I want you to breathe in for me. And breathe out. Again. And out. Alright, I'm going to put on a different spot. Breathe in for me. And out. Alright, different spot. Once again, breathe in. And breathe out. Okay, good. Now I'm going to go on your back and I'm going to put it on your back, okay? So just bear with me. It might be a little cold, I'm sorry. Alright, ready? Breathe in. And breathe out. Alright, from a different spot. Breathe in. And breathe out. Alright, and one last time, a different spot. Breathe in. And breathe out. Alright, your heartbeat is completely normal. There's no irregulations, there's no skips. It's perfectly fine. So the next thing and the last thing that we're going to do before the doctor comes in is we're going to do a sensory test, okay? So what I'm going to do is I have this metal thing right here, right? It's cold. It was in a fridge, so it's very cold. What I'm going to do is I'm going to touch different spots of your body, and I want you to say you feel it, and also if you feel that's cold, because sometimes you'll be able to feel a touch, but you won't be able to feel the temperature of the touch, okay? So I'm going to start off with your limbs, start with your arms, and I'll put it on your neck, and then I will go, and I'm going to try to touch stuff that is visible first, and then I will lift up your shirt and touch your abdomen, okay? And touch your sides, and still make sure you can feel things, alright? Okay, so I'm going to start with your arm. So when I touch it, you just tell me, touch, cold, okay? I'm going to ask you, can you feel it? And you go, yes, cold. Alright, ready? Can you feel it? Okay, and it's cold. Alright. How about here? Right outside your elbow. Yes. Okay, and I'm going to put it on your shoulder. Okay. And now your other arm. Okay. And right where your elbow is. Alright. Okay, it looks like your arm's pretty fine. I'm going to put it on your neck on both sides. Just make sure you can feel it and feel the cold, okay? Alright. Can you feel it? And cold. Okay. Another side. Can you feel it? And cold. Okay. Alright. I'm going to do it on your back. Alright? So I just want you to tell me, can you feel it? Is it cold? Okay, and again right here. Okay, see, I got you right there. I didn't touch your back, and you told me you could feel it and it's cold. Don't lie to me now. Come on. This defeats the purpose of this test. Alright? It's alright. Okay, now I actually put it on that time. Alright, and so now I'm going to do your legs, okay? So I want you to sit down, and I want you to just lift up one leg, and I'm going to start down from below, start on your calf, and then work my way up, and I'm not going to go past like 3 inches above your knee, okay? Because don't want to do it. Alright, so what about right here? Can you feel it? And is it cold? Okay. This side, can you feel it? And is it cold? Okay. So what I'm going to do now is I'm going to switch it out and do the other one. I have another one right here, which is not cold. This one's actually hot, okay? Since you can feel the cold pretty well, I'm going to see if you can feel this hot one, alright? Okay. So I'm going to put it right here from behind your knee. It feels cold. Okay. It's alright. Maybe it's just the temperature's a little different behind your knee than the rest of your body. Okay. Now what about here? Right above your knee. Okay, you can feel that it's warm there now? Okay. What about here on this side and above your knee? Okay. And your arm. You can feel the heat and a little higher. Okay, you can feel the heat again. What about right here? Here. Okay, so you can feel that side. Okay. So it looks like all your sensory test is fine, your blood pressure is fine, your heartbeat is fine. One more thing is I actually want you to open your mouth. I'm not going to stick anything in your mouth, but I just want to look at your teeth real quick. Okay, I know we're not a dentist or anything, but we can also see when you need to go to a dentist, and we can recommend you or refer you to one, okay? So what I want you to do is open wide, and stick your tongue out, okay? Okay. I'm just going to look up into your mouth real quick. Alright. Alright, can you move your tongue to the side? Yeah, like that. Okay. Alright. Just lately we haven't been using like the little chopstick thing to push down your tongue, with a popsicle stick to push down your tongue and look into your mouth. With COVID and everything going on, you know, we try to stop that because it's not, I don't say it's not necessary, but we can do without some stuff that we do. Okay? Alright. So, the doctor will be in momentarily, and I hope you have a great day, okay? Bye.